Hi, my name is Jonathan Finoff, and I'm going to be demonstrating a live ultrasound examination of the medial hip. I don't have any disclosures, but I do have a disclaimer. This presentation is not meant to be a comprehensive review of this topic. Our objective is to cover the core competencies as outlined in the AMSSM recommended sports ultrasound curriculum for sports medicine fellowships. We're going to do a medial hip examination. I'm going to place the transducer over the medial aspect. My subject's hip. I'm going to increase the depth here. I'm going to increase our focal zones. If we look at this, we're going to see three different layers. So the more superficial layer right in this area is going to be your adductor longus. Deep to that is going to be your adductor brevis, and deep to that is going to be your adductor magnus. You can see the fascial plane here and the fascial plane here. The anterior and posterior branches, the obturator nerve, run in the anterior and posterior fascial planes in these areas respectively. So if I scan back and forth, a lot of times you're able to follow. You can see right here neurovascular structure, and anteriorly you can see some neurovascular structures coming across there as well. But I'll glide all the way up proximally. Again, neurovascular structure right here, neurovascular structure right there, adductor longus, brevis, and magnus. I'm going to decrease the depth as I start coming up more proximally. And the tendon that tends to get torn most commonly is the adductor longus. And so we're going to come up, you can see the tendon right here. We're going to go all the way up to the pubic tubercle here. And so right there it's inserting on the pubic tubercle. And if I change this location, or change the transducer so it's in the long axis, this pubic tubercle will be on the right-hand side of the screen here, and I'm going to change the focal zone so it's more superficial here. Pubic tubercle right here, you can see the pubic tubercle right in that area. So the adductor longus tendon coming off of that region and coming out distally. I'm going to come down distally here, and I'm going to increase the depth a little bit so that you can see, typically you can see the three different layers. So if I go into short and go a little bit further distal here, I'm going to change the focal zone location. All right, so here's a tissue plane there, so adductor longus, brevis, and magnus going into long axis. So brevis, longus, longus, brevis, magnus, with the tissue planes, the fascial planes between the different muscles there. So those are your adductor longus, brevis, magnus tendons. You can look for the gracilis muscle. So here is the gracilis. So if here are your adductors more posteriorly, here's adductor longus. If I come just a little bit more posteriorly, here's the gracilis tendon right in this area here. You can see that gracilis right here. The other adductor muscle that is interesting is the pectineus. So if we come up more proximally, I'm going to change the depth here, move my focal zone up more proximally. So right here is the superior aspect. I'll change that focal zone up a little bit higher here, narrow it down a little bit. So here's the anterior aspect, the acetabulum, superior pubic. So sitting on top of that is going to be your pectineus. And so if I come off of that area, pectineus is right here, which is a little bit more lateral. And if I go a little bit more medial, you have your adductor longus, brevis, and magnus tendons. So longus, brevis, and magnus are more medial, and pectineus is right here, more lateral. And here's the femoral neurovascular structures right in this area, with the nerve, the artery, and the veins. And you can see the arteries coming back together. All right, so I'm going to have my subjects go ahead and straighten their leg out here. And what we're going to do now is look at the pubic symphysis. And the distal aspect of the rectus abdominis. So medial is going to be on the right of the screen, lateral is going to be on the left of the screen. I'm going to decrease the depth here. All right, so this is the rectus abdominis muscle right here. So right in this area is the linea alba. So this would just be the other rectus abdominis muscle. Because of the depth that we're at here, I guess we're more caudal, it's only transversalis fascia in this area rather than actually being in the rectus sheath. So that's all that's posterior to this area. If you have the person strain, go ahead and bear down for me. You can look and see if they have any fascial herniations or defects in the posterior aspect of this fascia. You can relax. But as I come down distally, you'll see the rectus abdominis is going to get smaller and smaller, and it's going to become tendon. And so right down in this area, it's becoming tendon, and it's going to attach. So I'm going to keep going. So tendon, 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 and it's attaching to a fibrocartilaginous plate that is anterior to the pubic tubercle in this area. And then it's going to be in continuity with the adductor longus if we go further down distally. So this is where the rectus abdominis, fibrocartilaginous plate, adductor longus, that's where that all connects. I'm going to rotate into long axis. Proximal is going to be on the left of the screen, distal is going to be on the right of the screen. So again, here's that rectus abdominis. Here's the tendon coming down. Here's the pubic tubercle right here. Here's the fibrocartilaginous plate, and the adductor longus is originating right in this area. So if you have an imbalance between the rectus abdominis and the adductor longus, this is where people get tendinopathy and tears, so it can contribute to athletic pubalgia or groin pain in the athlete. You can certainly have them bear down. Go ahead and bear down here again and look and see if you have any type of hernia in this area. You can relax again. Or weakness, if you come a little bit more lateral, then this is where the external inguinal ring will be. Go ahead and bear down again. And we can look and see if there's any weakness in the external oblique aponeurosis or fascia in this area, which would be the classic sportsman's hernia. We don't see that in this particular gentleman. I won't say that. So now I'm going to go back in the anatomic transverse plane. Here's the rectus abdominis. Here's the opposite rectus abdominis coming over here. In this area, as we come down more caudal, the linea alba is less defined. We can come all the way down to the pubic bone. And so right in this area, this is the pubic symphysis with the right and left pubic bones, the pubic tubercles in this area. So this is where the pubic symphysis is located, and people who have osteitis pubis, this is the location of osteitis pubis. And that completes the medial hip examination.